What would be the effects of trauma to children or pediatric patients? The effects of trauma to children or pediatric patients are they could have internal or external stress that can result to depression, anxiety, or anger. Effects of trauma to children may also include physical trauma. For example, is when the child is already traumatized in going to the dentist because of his past bad experience. This could affect the future of the child in going to the dentist because it is instilled in his mind that going to the dentist may hurt him. How can you help as a dental practitioner to cope with trauma that the children who experience it? Children who experience trauma is a different kind of management. However, the good and proper management to them is also the key to make the child less traumatized or make the child comfortable to not be traumatized. A calm, eye-to-eye contact and words that they can understand is important when talking to them. Making the child feel safe inside the dental clinic. Let the child speak of what happened and the reason or cause of trauma. And as a dental practitioner, I will assure that the traumatic experience that he encountered in the past dental clinic will never be felt again. Tell, show, do technique is also be used when the child is being curious on what procedure he will going through. And last, what are the ways that you can suggest to the parents to avoid trauma in children? The ways that I can suggest to the parents to avoid trauma in children is that the parents should be aware on what their children are doing. And if something happens, it is important to tell the truth and avoid blaming them. Having a clear communication between the parents and child is something important to have better connections. Parents should also know that validation of their child's feelings are important.